Good afternoon, everybody. Happy Friday. Thanks for being with us this afternoon. We're running a little bit late because we were tied up in a meeting earlier, but we're going to talk about COVID. We're going to talk about vaccinations, and of course, we're going to take your questions. So with regard to COVID, yesterday we reported 38 new COVID cases. That's much higher than we've had in a month. And we understand that some of those cases are likely older cases that got transferred to us, and the reason for that has to do with just the way the zip codes come out from the state. New numbers, so our average 7-day case average right now, 24 new cases a day. Currently hospitalized, 251 people, 73 of them are in ICU, 49 of them are on ventilators. Those numbers are up a little bit. So, we are continuing to carefully look at the numbers every day in order, hopefully there's not a trend here, but this is a blip. So we'll see. We've seen this before, and we'll see what, hang on here. Here we go. We'll see how it looks after the weekend. We know that the variant, particularly the B117 variant, is present here in St. Louis, but has not had a negative impact at this point in time. So those are the COVID numbers. Tomorrow we have our 14th mass vaccination event. We've had one almost every Saturday for several weeks now. This mass vaccination event, we have about 1,900 people who have reserved a time. I hope every single one of them will show up tomorrow. In addition to that, we have been working with the Department of Human Services. We will have a couple of hundred people who will be older people that needed to have transportation arranged for them, primarily older people. And we also have about 365 people who are of Hispanic or Vietnamese or descent who may need translation services. So we will have translation services there for them tomorrow. So all in, we expect tomorrow to do 1,800, 2,000 at a minimum. And so if you are one of the people that has one of the appointments tomorrow, please be there. I think that's really it for vaccination events. A couple of other things, if I could, just for a minute. So some of you are aware that the stimulus plan, which President Biden talked about last night extensively, that the city of St. Louis is poised to receive a significant amount of money. Now that money is to be spent over 4 years, 21, 22, 23, and 24. We have a framework plan for some of those funds because half of those funds will be received before May 11th because it has to be out within 60 days. So today we're happy to announce that St. Louis is one of 6 cities that has been selected by the U.S. Conference of Mayors and their partners to participate in a program called Stimulus Command Center. And those cities are Louisville, Los Angeles, Philadelphia, Birmingham, Dayton, and St. Louis. And really this is, there'll likely be other cities also in it, but these 6 cities are going to work together, pave the way, share ideas, best practices, come together in order to really think about the best way to get good long-term benefits out of the stimulus money that's going to cities. A big portion of the money that comes to St. Louis will make up for the revenue loss that we have had in 2020 and also still having in 2021, so that we can fund our budget to deliver the services that we need to deliver. But there will be, of course, funding for many programs that will help people. We know that people are hurting in this, and have been for a year in this COVID environment, economically and personally. And so we will be using some of that funding in order to help those people. Now, there will be a new administration in about 6 weeks. We will, this framework will be up to them as to whether or not they want to continue to provide, for example, homeless services. But I'm sure they will. Do they want to continue to provide housing funding for workforce housing, for low-income housing? All of those things are in in our thinking right now. How to increase, for example, supplier diversity. How to increase diversity in our entrepreneurial areas. All of those things are important and things that we may, as a city, over the next 4 years, be able to really make improvements on. So I just wanted to announce that today. I think it's a plus to be chosen by the U.S. Conference of Mayors to participate with these other cities. These are all mayors that I know, that I have spoken with through the U.S. Conference of Mayors, and I'm sure the next mayor will find this helpful as well. So that is on the stimulus money. Folks, you know, everybody who makes under $150,000 a year for a two-income household, or $75,000 for a one-income household, will be receiving a stimulus check of $1,400 per person in the household. And some folks will begin actually getting it in their bank accounts this weekend, I'm told. So that, I think, will be very, very helpful to people, particularly people who have lost their jobs, people who have had their hours reduced. The unemployment benefit of $300 a week additional federal unemployment has been extended through September 7th. The child care credit, which is $300 per month per child under six or under, $250 for an older kids, is going to begin almost immediately. So there's some relief coming on many, many fronts through the stimulus package that was just signed yesterday. So that's good news. Questions?
Couple of questions. So some folks are asking about the potential impact on the city getting more vaccine when the state shifts its allocation formula from population to percentage of people who are unvaccinated but eligible.
Correct. St. Louis will get more vaccine. St. Louis City and the region will get more vaccine because the state has changed the methodology. I was also yesterday in conversation with Dr. Randall Williams at the state about a mass vaccination event for the city of St. Louis. And they are also scouting sites for that, and we're working together to hopefully bring that to St. Louis as well. But in the meantime, as I mentioned earlier, we are doing our 14th mass vaccination event tomorrow. You do need to have a reservation. And of course, there are many other people also doing vaccinations. The Urban League is doing vaccinations. We have 8 pharmacies in the St. Louis City that are doing vaccinations, a couple of Walgreens, a couple of CVS's, and 4 independent pharmacies. So there are beginning to be more opportunities for vaccinations. We are continuing to focus our vaccinations on people 65 and older, plus those people under 65 who have underlying health conditions, as well as folks, the seniors, which I talked about earlier, which we will transport to the vaccination site, etc. So,
some folks have written in, they meet some of the eligibility criteria and have signed up, and wondering how the city is doing on making its way down its pre-registration list.
Well, there's 72,000 people on the registration list. Of that number, I think about 55,000, I think I have that here, are are from the city of St. Louis, so we focus on the people in the city of St. Louis. Maybe I don't have it. And we are inviting people by zip codes. We did, it'll be 2 weeks ago, we did a mass vaccination event at Omega. We invited North zip codes. Last weekend, we did one at Carpenter's Hall. We invited South zip codes. This weekend, we've invited a mix of North and South zip codes. So, but there are 55,000 St. Louis City residents on that list. And so there's still a lot of people that are unvaccinated. There are 33,000, I think is the number I remember. I don't know if anybody here can tell me the number. Is that right? 33,000 people who have been vaccinated? Okay. 33,000 people in the city of St. Louis who have been vaccinated. Some vaccinated at one of our mass vaccination events. Some vaccinated at at a hospital. Some vaccinated at events around the state. So 33,000 people have been vaccinated. It needs to be more. We have 115,000 people that are currently eligible to get the vaccination, in other words, over 65 or underlying health conditions. And so we still have thousands of people to go.
The rest of our questions have to do with the American Rescue Plan. James asked, how did the city of St. Louis end up expecting $500 million when Kansas City is getting $190 million and many other Missouri towns are getting less than the city?
James, good question. The formula that Congress used to allocate those resources was based on what is the level of poverty in your city? What is the age of the buildings in your city? What is the growth gap in your city? And St. Louis has just a very high percentage of people in poverty, of old buildings, of derelict buildings, of a growth gap. And because of that, we were eligible to receive more funding than other counties or cities, because those counties or cities are better off in terms of all of those metrics than the city of St. Louis is.
Taylor's question about the American Rescue Plan has to do with whether the funding can be used on infrastructure, like fixing bridges to improve neighborhoods and create jobs.
Taylor, we're unclear on that. There have been no regulations written yet. Bridges, we think, it doesn't look like they're eligible, but we are seeking guidance on that. What was the other part of the question? Bridges and what?
In infrastructure and improving neighborhoods to create jobs.
So in answer to that, we think, we believe that, for example, improvements perhaps to our recreation centers and our parks, which are expenditures that very directly impact people in a positive way, we believe that those are likely eligible. The regulations are not written, and the U.S. Treasury will be, and the various departments will be working on those regulations. You know, this is federal money. There's always lots of regulations. We know there are a couple of things that the money for sure cannot be used for, because that's in the legislation. One of those is you cannot use this money to fund a tax cut. So if we decided, oh, we have this money, we're going to cut sales taxes or property taxes or whatever, we would not be able to use the money to fund a tax cut. We also cannot use the money to fund any unfunded pension liabilities that we might have. Those were two things that were very specific in the legislation. So we are still waiting for regulations and clarity on some of this. This is only a couple of days old.
That's all I have for questions today, Mayor.
That's all today? Okay, well, a short Friday afternoon. Thank you all for being with us. Have a great weekend. Appreciate each of you. Stay safe out there and wear your mask. Thanks all.